Caregivers, have you ever felt like nothing, I mean nothing is going right? Well, cheer up and welcome to Dave the Caregiver's Caregiver radio program, where you'll learn how to avoid that dreaded thing called caregiver burnout and how to survive the grief process. You know, with roughly 100 million caregivers in the U.S. and Canada alone, that's about a third of the population. That means that everyone probably knows someone caring for a loved one. Join Dave and his guests now and every Wednesday at noon Pacific Time as they discuss avoiding caregiver burnout and surviving grief. So find a comfortable place to relax, kick up your feet, and prepare to feel better and to receive practical tips and tools that you can start using immediately to get you through today and every day so you can survive your tomorrows. But not just survive, but to live life fully and abundantly. Yes, you heard me right. That is a possible goal to achieve. And now, here's your host, Dave Nassani. Hey, Big LA, welcome for all my listeners out there in Radio Land. I'm Dave, the Caregiver's Caregiver, coming to you live globally through the worldwide Blog Talk Radio Network. Our goal here is to do our very best to help you avoid that dreaded thing called caregiver burnout. And we have an exciting show planned for you today with my lovely substitute co-host, Linda Bice. Say hello, Linda.
How are you guys doing today?
So sweet. Today we'll be interviewing Dr. Mary Lake Polan, clinical professor of obstetrics. I should have practiced that. Thank you, that word, yes. In fact, go ahead and introduce yourself, because the next word is just as difficult to pronounce.
I'm a clinical professor of obstetrics and gynecology at Yale University School of Medicine.
Great. So stay tuned, guys. You do not want to miss this show. I'm your host, Dave Nassani. The show's caregivers of every single kind. And the one thing we know about caregivers is that they are caring and selfless and sacrificial. And they have this tiny little problem. They tend to burn out because they put everyone else's needs above their own. And we can actually learn something from the airlines, including United, who likes to pull people off the plane. You know, they tell us in the event of an emergency to put your own oxygen mask on first before you attempt to help your loved one with their mask. Gosh, why do they tell us that? It sounds so selfish, right? A parent can do to their kid. They see their kid actually gasping for breath, and the plane's going down. There's flames, and can you imagine a parent putting their child's mask on second and not first? It's a hard thing to do, and caregivers are exactly the same way. They're kind of hardwired that way. They'll give and give and give until there's nothing left to give, and then they'll become sicker than the person they're caring for. Well, we also talk about grief and loss here and the devastating effects it can have on us. It throws us into this other thing called the grief process. Got to take days and weeks or months or years. You may never get over it, but we're going to help you get through your grief and your loss if you happen to feel like you're stuck. Hey, I want to take this time to thank my last week's guest, author Taryn Rose Seeley and Deborah Schuss. We discussed creativity generates love and success when Alzheimer's is along for the journey. Great show. You can see this show and that show and all our shows on our website, caregiverscaregiver.com. Just go to the Uplifting Interviews tab. And we're so excited. My new book will be available in September. I'll let you know when you can begin pre-purchasing it. It's called It's My Life Too. Reclaim your caregiving sanity by learning when to say yes and when to say no. All right, enough of that. Hey, a big welcome to our guest, Dr. Polan. Welcome to the show, Doctor. And thank you so much for agreeing to this interview. I'm so excited to have you. Why don't you take a minute or two and introduce yourself? I like to ask my guests just who is Dr. Mary Lake Polan and why was she put on this earth?
Well, I'm a reproductive endocrinologist. And
that's
OBGYN,
a mouthful.
With a specialty in reproductive endocrinology, which is really the study of infertility and abnormal menstrual cycle and menopause. But I do a fair amount of general gynecology, and it's quite interesting, the topic you've chosen, which is incontinence, which affects women more than men, but it also affects men. And it can be a major impact on someone's life.
So you handle incontinence as well in your practice, yes?
I do see patients who have incontinence. There is another subspecialty in OBGYN called urogynecology. And those are the people who do the testing, the major testing, and the surgical procedures for incontinence.
Hmm.
Hmm.
So that kind of makes you a urologist, or is that not a proper term for what you do?
No, I would say that most women, if they have a problem, come to their gynecologist first
Really?
because they get used to seeing a gynecologist, whether they're having babies or getting pap smears. So
Hmm.
we see an awful lot of incontinence as the first doctor contact.
I see. So there's different kinds of incontinence. I thought there was only one. Tell us, educate us a little here.
There are really two kinds. One is called stress urinary incontinence, and you'll see the initials SUI. And this is a form of incontinence where women lose urine when they cough or sneeze, when they laugh, when they have intra-abdominal pressure. And it occurs primarily in women who've had a bunch of children, which weakens the pelvic floor. It can also occur in women who are heavy, and sometimes in women who simply have a genetic predisposition to lack tissue.
Mm-hmm.
And that's treated in general with the first thing you do, because it's always good in medicine to try the least intervention and work up to more aggressive interventions. The first thing is to try Kegel exercises to teach women to contract their pelvic muscles to retrain the bladder. And they can do it themselves with Kegel exercises, or you can go to your gynecologist, and there is a program of retraining pelvic muscles that's produced by Consortia Health, and many gynecologists have it. And it also helps to retrain the pelvic muscles so you don't lose urine when you cough and sneeze.
So I would assume you would recommend that they use diapers or those little pads, just to avoid accidents.
Yep, that's primarily to avoid accidents and to avoid staining their clothes. If they're out, it's very difficult. And actually, having incontinence keeps people homebound. They don't like to go out.
Yeah.
Well,
I'm a man, obviously, and I have an enlarged prostate, and I have very similar issues, but I take Flomax, and they've all gone away. Now, you only see women, right? You don't see men?
I only see women. But men also, you're right, men have incontinence. And they sometimes with prostate difficulties, they have incontinence. But they also have more of the second kind of incontinence, which is called urge incontinence. And that's where all of a sudden you have to urinate and you just don't have time to get to the bathroom.
It just comes on you just like that, huh?
Yeah, and that's a neurologic problem. That you can't really retrain your pelvic floor to deal with. That's the kind of incontinence that can be treated with medications or acupuncture. I have suggested acupuncture. Sometimes that helps too.
So it's a neurological problem? You mean it's just in their mind? Their bladder might have been full, but they didn't have the urge, and now all of a sudden it comes upon them? Or maybe their bladder isn't really, really full, but it feels like it is? I mean, is that kind of what you're saying?
Yes. And that tends to be something that comes as you get older. And men have urge incontinence too. It's the sort of thing, I don't know if you or any of your listeners have been in a position of going to the movies, and then the movie is over and you get up and you walk to the bathroom. The closer you get to the bathroom, the more you have to poop.
All I know is sometimes I can't make it through a full movie, so I try to go to the bathroom first. But sometimes that doesn't always help. Wow. Linda, let me introduce Linda really briefly. Go ahead and introduce yourself, Linda. She has a question about diapers and stuff.
Yeah. Well, my name is Linda Bice. I live in Anderson, South Carolina, and I am a full-time caregiver for my husband, who has been bedridden for 10 and a half years now with severe brain damage. And then our son was paralyzed from the waist down the year after that happened. But he is, as a matter of fact, my son is, even though he can't feel his legs, he is now walking and in Peru at this very moment working with handicapped children. Yes, absolute miracle. But now with my husband, of course, he's in diapers. When this happened to him, he was dead for an hour and 20 minutes when he was 49. And while he was in the coma, they had, of course, they had a catheter. But as he came out of the coma and began moving around and stuff like that, he would pull the catheter out. And from then on, we have put him in diapers. He is, it's the typical like baby diaper type. And some of the strange things that we were talking about is he will, we call the flood zone. About every 4 to 6 weeks, he will go through 28 to 48 hour episode where, oh, have mercy. It's like his body is evacuating every bit of liquid that's in his body. It's like I'm up and down all
Maybe
night.
he had a diuretic.
It's just like, you know, it's TTN and TTN, you know, it's like constant. And I'm changing diapers every hour. And so that just absolutely blows my mind. And it's like a cycle. I mean, do you know what would, you know, have you ever heard of that? What would cause that?
I've not heard that. I do know that as you said, diuretic medications, Lasix.
Yeah, no, he's not on anything like that.
And he doesn't drink coffee, right?
No coffee, huh?
Nope.
Just milk and some tea for, you know, a meal, but milk in the mornings and then water bottle, you know. But during this time, it's not that he's drinking more or less. He is literally the same, you know, the same thing that we always give him. So it's just always blown my mind that he does that.
I really don't know what's going on. Have you spoken to his doctors?
Yeah, they just kind of, you know, they're just like, well, you know.
They don't know.
Yeah, it's not something that they have. And I asked one time about there's a medication that you can give that, you know, helps them. You probably know, of course, you know this medication, but it will cut down on the urination. And the doctor did say that men could not take that. It was only for women.
Oh.
That I can't remember what he said, the reason being, but he said that you cannot give that to a male, but it has to be.
Yeah. So the way you described, Doctor, that the two types of incontinence, all those commercials I see on TV now, all of a sudden make sense. You know, the urge to go and what have you.
Yeah.
Now let's talk about catheters for a moment. I'm starting to see on TV now the advertising catheters that are supposedly easier to put in, easier to take out, you know, are not painful. Now, I've only been catheterized a couple of times when I was on morphine because of a broken arm, and I just couldn't go to the bathroom, and I thought I was going to bust. And as painful as that catheter was going in, I was very grateful for it. But is there any easy way for a man to be catheterized without? I can't even think about it.
It's uncomfortable for anyone to be catheterized.
Uncomfortable. Did you hear that, Linda? It's uncomfortable. That's like childbirth is uncomfortable.
Well, you know, there are two kinds of catheters. They're indwelling catheters, which are the long rubber ones with a balloon on the end, and you put that into the bladder, expand the balloon, and it stays there.
Are we talking about men or women or both?
For both. And that's probably the kind, Lynn, that's probably the kind your husband was pulling out.
Oh, yeah, because he was, of course, he was like an infant, you know, I mean, a 2-year-old, because he was going through all these really strange things while he was in the hospital due to the brain damage, and it was like they couldn't even keep the. They tried to put a feeding tube, and he pulled that out too. So it was like trying to do that to a 2-year-old, you know. So he literally. So, but yeah, he would not put anything in.
They drain into a bag so that you can measure the urine every 6 hours or 8 hours.
Right.
But there are other catheters. There are straight catheters. There are sometimes people who have been paralyzed or who've had surgery that disturbed the nerve, who can walk around, but they just can't manage the muscle changes that you need to urinate. And those people can use straight catheters. And
yeah, my son had to do that.
Right, and they catheterize themselves, 4 times a day. And,
yeah, it was every 4 hours.
Right,
mm-hmm.
and that's different because they're capable of doing it themselves, and
right.
they just do it when they're uncomfortable, and then they get a new catheter and catheterize themselves the next time. So they're used for 2 different purposes, those kinds of catheters.
So you say women suffer more?
Women suffer more incontinence, yes. It turns out that about 70 to 80% of incontinence is female. So more women have incontinence. Now, it is true, and you were correct, as men get older and have prostate problems, they too have urinary dysfunction and problems. Yeah. And certainly after prostate surgery, some men are incontinent. And simply where, I should say that aside from the indwelling catheters with the balloons in the bladder and the straight catheters that you can catheterize yourself with, and, people travel with those and they live a pretty normal life. There are also what are called condom catheters for men. And they look like condoms, but at the end they have a rubber tube and it fits right over the penis. And then you...
Yep.
We sounds less painful.
Too. Yeah. We tried that with my husband, but he wouldn't leave it on and he pulled it off and made a huge mess. But yeah, it was actually my sister ordered the ones from NASCAR that the NASCAR drivers use. And she paid a lot for it, and we tried that with my husband, but it's like putting it on a child. He would not keep it on. But yeah, if he would have cooperated and kept that on, it would have been perfect because it's not painful.
It's not painful, and also it doesn't. If you're using diapers or pads, you get urine all over, and you have to change it. Damage the skin.
Yeah, he made a huge mess.
So, I mean, you touched on what causes it, but is there any hope for people who have this? I mean, I remember so many women were, we were laughing and joking around, over the years, and I can't tell you how many of them says, "Oh my gosh, I peed in my pants," or "I almost peed in my pants," and I always thought they were kidding, but I guess it's more real than you're talking about.
They really probably were not kidding.
So. Any other solutions besides the ones you spoke about?
Well, as you go from least invasive, which are Kegel exercises, a formal in your doctor's office program of pelvic floor stimulation with Consortia Health, there are for stress incontinence procedures, surgical procedures that can be done. The best way to decide, the patients I see have incontinence, and I talk to them. Many women will say, well, I wear a pad now and then, and that's fine. I don't need to worry about it any more than that.
But we're not talking about the kind of incontinence where they're just, every time their bladder is full of something, it just comes out. We're not talking about that?
No, we're not talking about that. If you
What's that called?
Like that, then you really need to see a urologist or a urogynecologist and have what's called urinary function test, where they will put a catheter in your bladder, fill the bladder with water, and as the bladder fills up, it starts to contract because it's surrounded by muscles. And they will measure at what pressure does your bladder contract. Can you empty it? Because part of stress incontinence is not being able to completely empty your bladder, so it never gets totally empty. And if you really have severe incontinence, you should be seen by a urologist or a urogynecologist, and you should have the urodynamic studies done, which tells you whether you should be on medication, whether you can perhaps train your pelvic floor and bladder to behave better, or whether you need surgery.
How about, you did mention the option of just walking around with a bag.
Yeah, you can do that.
That's the worst case scenario, right?
Well, the other problem with indwelling catheters, which Linda may know about, is people tend to get infections. They get urinary
bladder infection.
Yeah.
My son went through that. Yeah.
Even if they're taking it out and putting it in every 4 hours, they're still prone to infection?
Yeah. you would want to use a sterile catheter every time you catheterized yourself. But yeah, you can still get infections, even being careful.
Yeah. Yeah, he was in the hospital and with that. He was in the Shriners Hospital in Philadelphia. And it got to where it was just blood coming out. And
I'm sure there's worse things to have, but that sounds pretty inconvenient, to say the least.
And painful.
So, new therapies, technology, anything on the horizon that we could look forward to?
Well, there's some electrical stimulation things that that can be done, and you can try those. Sort of like a TENS machine. Do you know what a TENS machine is?
Yes. For back pain and muscle stimulation, electrical current.
Yeah. Right. And there are procedures and devices that can pass mild electrical current and try and stimulate the muscles. And it's the same thing as doing Kegel exercises or lifting weights for your biceps. The more you stimulate, the stronger they get.
Linda, is there any hope for your husband to get potty trained? I mean, if he's mentally two, there's 2-year-olds that are.
But his problem is he has, along with all this other, he has no short-term memory. Everything you teach him right now is gone in 10 to 15 minutes. So there is, believe me, I've tried everything over 10 and a half years. But
he's kind of like that 10-second Tom on that movie.
Exactly what, 51st Dates.
51st Dates.
That was our training film back then. But now, thing I wanted to ask too, you've got me thinking about. Now I'm up and down all night long, checking my husband's diaper, changing him, and it's like, I get up and it's 1 o'clock and I change his diaper, and within 10 minutes of changing his diaper, it's like 90% of the time he will soak the diaper that I just put on him. And I have tried, I don't even know how many things. I've tried, like, just open the diaper and close it back up. Like, maybe it's just in his mind, and, he'll think of changing it, and he will, not wet the diaper. So, it's like there's, I can't understand why that happens. It's not, to me, it's not like he's saying, oh, I'm just going to wait till she changes it, and I'm going to wet the diaper. Because his brain damage is, to where I don't think it's possible. But what is it? And the funny thing is, too, all right, I changed his diaper the first time. Well, when my feet hit the floor, I go to the restroom and I urinate. I go and I change his diaper. I come back in here and I have to go again. So I go, and then I go back and change his diaper again. And before I come back to the bed, I have to go again. So I'm like, what?
All this talk, I have to go. Thanks a lot, Linda. No, I'm just kidding. I don't think anybody has an answer to your question, Linda, right, Doctor?
I don't think so, but I would suggest one thing. It may be if you completely empty your bladder, you won't have to go again so rapidly.
Yeah, maybe your bladder's not emptying.
You're not.
Well, that's my problem. Because I'm thinking that it's empty. So it's like I can't be upset with him because, have mercy, it's happening to me too. So I'm like, what is this?
My urologist did a test on that, and he says, you can never get rid of all of it. But there's, what's the number that you should be concerned about? What percentage, Doctor?
I didn't understand the question.
Yeah. I think he said something like 10% is normal. I don't know. So insurance covers all this stuff?
Yes. Insurance will cover the surgeries. It covers the medication. And it will cover the bladder training. Yes.
Well, obviously these therapies will change people's lives, give them more freedom. How popular is it?
Oh, I think the success rate is pretty good, and I think any kind of reduction in incontinence is helpful to women, and I think to men too. Whether you put in a pessary to keep the pelvic organs elevated. Sometimes that helps, just insert a pessary into the vagina. Sometimes that helps with incontinence too. But I think anything that you can do that diminishes both the number and the amount of urinary accidents is helpful to people.
Yeah. Well, I guess you've got to go. You've got patients lining up. What's the best advice you can give a caregiver that's taking care of someone with incontinence? The final afterthought.
Oh, I think probably what you said, patience and tenderness, that's important.
Mm-hmm.
And I think it's also important to keep the skin really clean and dry so that it doesn't break down. You know, when skin gets moist, you get fungus growing or bacteria growing, and you can have real problems. So I think it's keeping them clean and dry and changing them frequently.
Anything we can do to prevent infections? I know we don't want to just load up on antibiotics because that's a problem now. We've got all these germs that can't be killed because every doctor was so quick to give an antibiotic. What's the hope on that?
Well, I think just keeping somebody as clean and dry as possible so you prevent infection.
All right.
Mm-hmm.
Where are you located, by the way?
In Connecticut.
On the East Coast. Linda's on the East Coast too.
South Carolina. Mm-hmm.
But
So,
Linda, I wish you good luck. I'm sorry, but I'm going to have to run now. I do have people waiting. But
thank you so much for coming on.
And I wish you good luck.
Thank you. And it was awesome to get to talk to you.
Do you want to give any contact information, Doctor?
They could call my office through Yale. They can call the Department of OBGYN at Yale.
All right. Well, thanks again.
Thank you.
Thank you so much.
We're going to take a break. Be right back.
One Arm, One Leg, 100 Words, Overcoming Unbelievable Hardships is about Charlene, a stroke survivor. Back in 1996, Charlene was a healthy, normal, very active 52-year-old woman whose amazing talents resemble that of both a Martha Stewart and a Wonder Woman. But all that changed when she suffered a massive stroke that left her severely speech impaired and paralyzed on the right side. Who am I? My name is David. I've had the privilege of being Charlene's husband since 1975. We had a wonderful fairy tale storybook-like courtship that culminated in our marriage a year later. Charlene had just come out of a marriage where after 10 years, she received 2 black eyes and a broken nose by her former husband when he came home high on speed. Charlene believed in no second chances of any kind for abuse, so she left. Finding herself all alone in the world with her 5 and 10-year-old daughters Cynthia Lorraine and Deborah Lynn, she started raising them by herself for the next 2 years. Then fate brought us all together. After falling in love with Charlene, Cindy, and Debbie, our love then produced Rebecca Elizabeth. We had a wonderful, normal life for the next 20 years. But today, things are very different for everyone. One Arm, One Leg, 100 Words, Overcoming Unbelievable Hardships is the amazing story of a woman's fight to survive all that life had thrown her way. Everyone who knows Charlene is thoroughly amazed at how she lives day by day, month by month, year by year, and with a smile on her face and hope in her heart that everything is going to be okay. Her faith in God is her foundation in this hope, that everything happens for a reason, and what doesn't kill her will make her stronger. She inspires everyone who meets her. Her accomplishments since her stroke are very impressive, often making us normal people look like whiners and complainers. So pick up your copy of One Arm, One Leg, 100 Words, Overcoming Unbelievable Hardships today. You won't be disappointed. Just hear what best-selling author Lynn Barrington has to say about it. If you think you have it bad, read this book. This is a beautiful, genuine story told from the heart. It's inspiring and easy to read. When you finish this book, you'll be able to look at your concerns in a new light. How about the reaction of 9-time Grammy and Dove Award recipient, the godfather of contemporary gospel Christian music, Andre Crouch? Charlene just won't let the promises of God go, and she has not let her circumstances get in the way of her faith. She's not just a survivor, she's more than a conqueror, as the Bible states. You'll be encouraged by her testimony, regardless of what you're going through. Available everywhere. But if you purchase your copy directly from the author's website, onearm1leg100words.com, Charlene and David will personally autograph your copy. Enjoy.
And we're back with Linda Bice. Dr. Polan had to go. She has patients. You know how frustrating it is going to the doctor's office, getting there on time and waiting an hour, and if you miss the appointment, then they charge you, right? So I've always wanted to charge my doctors for keeping me waiting. Linda, I want to talk, we've talked enough about incontinence. I don't want to talk about that anymore, but I do want to talk about sleep and interruptions of sleep. And let's go more deeply into your sleep patterns and how you do this, because I'm sure there's other people out there who don't get any sleep, and maybe you have some, ideas or things that have worked for you that might work for somebody else. Tell me everything about your sleep and your rest and getting back to sleep or taking naps in the day. I mean, just cover the whole gamut.
Yeah, most of the time, I try to get in the bed by 9 o'clock. And, I've got David ready and diapered, and by 12 o'clock, by 9 o'clock, I'm in the bed. And I usually will wake up. I used to have a timer, and I would set it for 2 hours. But after all these years, this has been 10 and a half years, my brain is on its own timer because I will automatically wake up. Yeah, there is no worrying about. As a matter of fact, I wore my timer out. It's broke. But my brain, I'll automatically wake up, and I will go check David. And I would say 50% of the time he's wet. And I always joke and say, if I go in there and check him, and he's dry, that's like winning the lottery. So I come back, and if I haven't had to change his diaper, I will generally, fall back to sleep within a few minutes. But there's something about, if I have to change his diaper, and then I clean everything up and I throw everything away, and I will come back and go to the restroom, and then I go back and I check him, and 90% of the time he is wet again. So here I go, changing, doing everything all over again. Well, by that time, I'm awake. It's like my brain's like, okay, time to wake up. And I can come back to it, and I will lay there. And, of course, I know everybody has been through this. You've got 50,000 things running through your mind. And, and I'm the world's worst at thinking of something that I need to remember. So I grab my phone, and I will send myself a text message to remember something. So I'm on my phone. Why don't I check Facebook? So I turn on Facebook, and I'm reading or check my emails, and before I know it, it's time to check him again. It's like 2 hours has passed. So I'm back in there and checking him and maybe changing him again if he's wet again. And but that is my problem, is falling back to sleep. And we've tried melatonin, a 5 milligram. As a matter of fact, I give that to David every night too. But sometimes that will work for me, and sometimes it won't. But on an average, I probably will get a whole 5 hours of sleep at night, but nothing consecutive. I'm up and down and awake. So I sometimes, my son will hear me say this. Well, not sometimes. I say this a lot. I literally feel like I'm living in a fog. And
I guess so.
So it's like, and unless you go through time after time and night after night and year after year of this, you cannot really comprehend or, understand how it really feels. Now, I'll give you for instance that I came up with this thing with my son. I'm like, okay, give me one night a week, one night where you get up and down and you take care of your dad and let me sleep that whole night. Now, through the years, we've tried this several times, and he will do it, like for a couple of weeks, and then it's that one night a week, and then it's like, he doesn't want to do it. So I'm always joking.
He doesn't have that motherly instinct.
Yeah, I said, do you think I want to do this? That I want to get up and down all night? It's like I literally have this craving I want to be able to go to sleep and close my eyes and not have to worry about anything until morning, to just to
So
sleep.
when you got that one day off, how long did you sleep uninterrupted without waking up?
That's the sad thing. I still woke up, but the good thing was I didn't have to get up. So it's like this, you wake up and it's like, oh man, I woke up, but then you think, oh, I can just go right back to sleep. So it's like this little thing I always say, it's like winning the lottery, yay! But people do not understand how precious sleep is until you have been through something like this. So, it's not built in me to say, oh, forget it. I'm just not going to go in there and check him, because I just can't do that. I guess it's a mommy thing. I always say it's a mommy thing, but it's just like knowing your child is in there uncomfortable or wet or scared or cold, and see, that's another thing with him. It's not just if he's wet or not. If you're cold, to pull up the cover, or if you're hot, to throw off the cover. He doesn't know to do that. He will be laying in there soaking wet with sweat, but he does not realize that all he's got to do is pull that cover off of him, or he's rolled over and the cover's off his back, or and he doesn't know to pull the cover up. So that's another concern that I'm always checking and back and forth. So
I can't see where the time goes. It goes so quickly. So if someone wants to get a hold of you or encourage you or ask you some questions about what how does someone get a hold of you, Linda?
Well, we've got our website, which you can also comment on that. It's www.bicefamily.weebly.com. That's www.bicefamily.weebly, WEEB as in boy, LY.com. And also, I'm on Facebook at Linda Bice, and we also have an email at thebicefamily@gmail.com.
Thank you so much for coming on the show last minute. Adrienne had a headache and couldn't come in. She gets these migraines. So everyone, we'll see you next Wednesday at noontime. Just go to our website and take that short quiz, Are You a Candidate for Burnout? Just for doing that, I'm going to send you my first book absolutely free, a $10 value. So my wife's amazing story, 1 arm, 1 leg, 100 words, overcoming unbelievable hardships. So until next time, we will see you. Bye-bye.
Thank you for joining Dave, the Caregiver's Caregiver radio show. Make sure you tune in every Wednesday at noon Pacific time and anytime afterwards on podcast to catch more of Dave and his tips to caregivers on avoiding burnout and surviving the grief process right here on the Worldwide Block Talk Radio Network. Goodbye.